Well, good morning. Thank you everyone for joining us today. I am Lindley Wall. I'm one of the orthopedic surgeons at Washington University, and I'm joined today by my partner. He will introduce himself, but we are going to discuss today finger jams and injuries in the pediatric population. We know it kind of ranges broadly, and we'll kind of talk through those about appropriate care and what to do. So, Chuck, you like to introduce yourself?
I would. I would. Good morning, everyone. Thanks for joining us here on Facebook Live. We're going to talk about finger jams, not to be confused with toe jam because we don't like that. We're going to talk about finger injuries. Dr. Wall, what are we going to talk about? How are we going to talk about it?
Yeah, I think when I think about fingertip injuries in kids, there's a huge range. So as we kind of present initially, you can have little fingertip injury, especially in the young kids. So why don't we start with that? So those little tiny kids, the 1-year-olds, the 2-year-olds, we see those a lot. I would say most commonly they're, fingers stuck indoors. And then as a parent, you see it, there's a lot of bleeding. And so what would you tell parents? You see that you're at home, bloody fingertip, what do you do? Where do you tell them to go?
Yeah, so I totally agree. So the little kids, and we're talking 2, 3, most commonly, so they're old enough to get into trouble and not old
Yeah,
enough to stay out of
walking.
trouble. Yeah,
Yeah.
walking, grabbing flower pots and putting them on their fingers, closing their fingers indoors, exactly as you said. Yeah, those can be scary because obviously the child is usually screaming, there may be some bleeding. And so, while we are always happy to see you at our orthopedic injury clinic, if that's not the most convenient spot, I think an urgent care is a good place to go. Certainly, St. Louis Children's Hospital Emergency Room or any of the affiliated Children's Hospital emergency rooms are great options. Thankfully, and I'd love your thoughts, these are not typically serious. There's a couple warning signs we'll discuss, but in general, these things are scary and they're ugly, and then they do just great.
Yeah. Yeah, you know what I'd say, it kind of depends on the level. If it's just the very tip of the finger and it's just bleeding a little bit, I think urgent care is great for that. If it's a little bit more as it kind of goes up the fingernail and if the fingertips kind of dangling a little bit, which is very scary for a parent. But I think the ER may be the best because oftentimes the ER has really good resources to make fingers numb, to do an appropriate repair because sometimes you have to put a couple stitches into that nail bed to line the finger up. And that's usually kind of all that has to happen. And I don't think necessarily always urgent cares can do that. They don't have sedation for kids. But I think it depends on sort of the severity. But an ER can be very good at sort of being the final step. And then obviously following up with someone like you or me to kind of watch it heal. Um,
Yeah, I think that's exactly right. I would say that, when you think about fingernail injuries, in my mind, they come into kind of three categories. One category is, if you can see mine, is when the nail kind of pops up. And so it looks like it's okay towards the tip, but a little further back, it's kind of popped up. Those can be minor, but they can also be sign of a bigger injury, I think, as you were alluding to. And so those are probably more than I would recommend for someone's office or for, or for an urgent care. Those probably need to go to the emergency room.
yeah.
And still not a huge deal, but something to address. The second kind are where you get bleeding under the nail, but not necessarily outside of the nail. And for most of those, we ignore them. We try to ignore them. In years past, we would take off the nail and get out these tiny stitches, but we don't really do that anymore. And then the last group would be the ones I think you referred to as well, where maybe we have to stitch the tissue beneath the nail or use some glue, depending on the situation. And so again, you want the right people examining your kid. And so where you go depends a little bit on severity, which can be tricky. You won't go wrong with going to a children's emergency room, but sometimes you can get away with less.
Yeah, I agree. And the good thing is most of these do very well. If we get things lined up, and most of the kids, I will tell you this, will lose their nail. And so I always start that conversation early because a lot of kids, it kind of freaks them out to know that their nail is going to fall off. But usually and almost always a nice new nail is going to grow back. And then another thing, if the door hits the finger just right, it'll take a little bit of that skin off the end and it leaves a little bit of exposed bone. And that always is kind of a hard concept for people to be okay with. But I will tell you, in kids, please let me know your thoughts too. The skin typically heals over the end of it. So we don't necessarily have to shorten the finger, but usually with time, the skin heals up over it. And obviously we like to watch that happen and make sure it happens okay and infection doesn't set in. But if you keep it clean, that typically heals nicely. Do you agree? Do you do anything differently or?
Yeah. Two comments. One, I
Yeah,
always like to say kids are like salamanders, and so if there's tissue that comes off, they will regrow that tissue. So often, occasionally, a bigger injury, maybe not, but we give kids every chance to heal before
yeah,
we talk about surgery and stuff like that. The second thing is little known facts about fingernails, and this is super exciting for all of you lovers of hand like Dr. Wall and myself. So fingernails grow at the same rate as your hair. So no comments about my hair, but if you have hair that grows rapidly, fingernails grow rapidly, and they also grow more rapidly in the summer. So if you do actually lose a nail, whether that be you or your child, they'll grow back almost always. They start off irregularly, and then over time they get better and better, but it can take months.
yeah, yeah. And usually, sometimes I'll have our therapist make a little protective brace during that time, especially for sports when kids are trying to be more active and they don't have a nail, because a nail really provides some protection. But yeah,
Yeah,
um,
not for the little bitty
right,
kid, but yeah, a
but
good
a
for
little bit older.
teenagers. Yeah,
Yeah. Well, that was my lead into sports injuries. So I
perfect.
think that's another another thing that's really, obviously with COVID things have calmed down a little bit, but everyone's still out there playing, throwing balls and jamming their fingers. So what are sort of the concerning but end up being benign injuries, would you say, for finger jams, maybe tips or even more other joints in the finger?
Yeah.
How do you address those? Yeah.
So let's start. I don't know. We can start anywhere. So if we look again, my own finger, let's take the middle joint. We call this the PIP joint. That joint is probably the most commonly injured joint in the finger. Thankfully, most injuries to that joint are minor. So there can be sprains, and we'll talk about what that means. There can be small fractures, so we can talk about what that means. And there can be more serious injuries. So let's talk about sprains first. So for me, a sprain means a partial or complete ligament injury. And there are, like every joint, there are ligaments on both sides of the joint. And so the ligaments help to keep the finger stable so it's not kind of moving too much when you pinch and do things. And so almost always sprains in the finger heal just fine. It's super rare that that's an issue. So that, if there is a sprain, it'll swell. And that's always a source of confusion. We can talk about that. But for me, sprains are rarely a long-term problem. Is that how you
Do
think
you,
about it?
yeah. And I guess, do you think that families, if they think it's just a sprain, should they still get an x-ray? What are your thoughts on that?
Yeah, there is a parental guilt issue sometimes and I'm guilty of not being the best
Yep.
parent at times. I usually give it a day or two unless it's obviously angled or crooked or won't move. Because if it's just swollen, you ice it. I agree with Motrin, and I give it a day or two. Again, this is all about your, as a parent, comfort level. And if there's any doubt in your mind, you take them in. For
Right.
something like this, our injury clinic is perfect, or a
Yeah.
next day visit with your doctor is perfect. You want to try to stay out of the ER for something like this. But yeah, sprains do fine. Here's the interesting thing for me is that fingers stay swollen forever. So the swelling is not usually the issue that we worry about. Other things make us worry.
Yeah. No, absolutely. I kind of say swelling can stay around. It'll be a little bigger than the other finger for months, 6 months. But I think the key to it, just like you said, is, evaluating in a couple days. And what you don't want to do is leave a finger like in a little alumifoam splint or, on a popsicle stick for a long time. Because if it's a sprain and you have an injury to those ligaments, you want to get it moving, because the last thing you want is a stiff finger kind of after all of this. Even kids can get stiff. So I usually say rest it, 5 to 7 days, but then, make sure you get it moving. Uh,
Yeah, I think of all the frustrating things we see in our office is when a kid comes in having been seen elsewhere, and I can say pretty confidently in our system, this almost never happens or never happens, where it's a little bitty fracture, and typically that fracture is on the bottom here. We call those volar plate fractures, which is really a really nothing injury in most cases. And the kid gets put in a splint. This aluminum splint. There's this blue foam on it, and they get put in the splint, and they say they're told to fall up in 3 weeks. And then they
yeah.
come in, and then we have a problem because the finger's stiff, and it can be hell to get that finger unstiff, if that is a word.
Yeah. Yes. One thing just to kind of add, in addition to you have your bones and you have your ligaments, you also have tendons. And so just kind of, this isn't really a tendon, discussion, but I think it's worth mentioning. So jamming fingers, so out here, this joint out here, oftentimes if you jam that, you can actually tear the tendon off the top. And so that's where you get a finger that kind of droops down. We call it a mallet finger. And I would say in kids, it's more likely to take, when that tendon pulls off, the one that straightens the finger, it's more likely to take a little piece of bone with it. So if you have a droopy finger in a kid, I do think that's worth getting an x-ray if they can't straighten it. Because sometimes if that little bony piece is really big, we sometimes actually do surgery to make sure it's lined up. Adults, a little bit less likely, more likely just tendon issues. The tendon tears off and you get treated in a splint, not with surgery. So, that's kind of a little bit of a different injury. And then there's also a tendon at this level, at this joint. Less common in kids, would you agree? More common in adults, but tendon is right over that joint. So you may think, the sprains are a little more sore on the sides, and then the tendon injury on the top, and those have to be taken care of.
Yeah, that's exactly right. And for both of them, the idea is that if someone else can straighten the finger, whether it be this
Yeah.
joint or the next joint, but the child or adult, whomever, is unable to do that. And those can happen lots of different ways. But I think Dr. Wall made a really good point. So when we, and that is two physicians who think a lot about kids' hands, when we think about this, we think a lot about growth plates. And the growth plates are scary for those who don't deal with growth plates a lot. And that can be adult emergency rooms, that can be urgent cares, because identifying a fracture near a growth plate can be tough for those who don't see these all the time. And so growth plates are tricky, and growth plates are the problem because kids' tendons and ligaments tend to be really strong, and the growth plate is often the weaker area. So is that how you think about it, or what are your thoughts about growth plates and the whole thing?
Yeah, absolutely. Kids are more likely, their bones are softer and the growth plate is the softest part. So they are more likely to injure their bones than necessarily tear ligaments and tendons typically. But I would say, that being said, we typically in the finger don't see many growth plates persistent problems. The growth plate in the fingers don't necessarily shut down, and that's everyone's concern. Oh, growth plate injury, the finger's not going to grow, and I don't see that. I can remember like just a couple kids where I've seen that, and long term, it's not really a problem. Different than places like the wrist, which it can be a big problem, or at the knee or the ankle, where growth plate injuries can be a big deal. In the fingers, not so much. You agree with that?
Yeah, totally. So in the fingers,
Yeah.
we worry about the growth plates being weak points leading to a deviated or angled digit. And if that's the case, you don't need to be a board certified hand surgeon to see a crooked finger. And
Yep.
if your kid's got a crooked finger, then, you got to bring them in.
Yeah. Well, let's talk about crooked fingers. So there's a lot of different types of finger fractures, the whole length of the digit. And there's some that, I guess what you said is exactly right. Deviation is a big deal. That doesn't change. Bones will heal. So kind of, what are your thoughts on fractures in fingers, and when do you like to see them? What do you typically do? And what are the ones that are concerning?
Yeah, one of the best things about being a kid, that didn't come out right. There's a lot of good things about being a kid. One of the best things orthopedically about being a kid is that kids heal fast.
Yeah.
And when you get old like me, I don't heal fast, but kids have a covering on the bone called the periosteum. And that periosteum just makes bones heal really, really quickly. And so by 2 weeks in some of these fractures, there can already be healing. And so for that reason, we want to see it soon. And again, if your kid has a crooked finger, I don't think you're going to hang out for a week, but either that evening or the next day, again, a perfect reason to come to the clinic or to our orthopedic injury clinic or the emergency room. I mean, clearly, if you have a really deviated digit, that's going to need to have something done. And often the emergency room can treat this and be the only treatment you need.
Yeah. Yeah, I think that having it identified early is important. And then you don't necessarily have to come, if there's a lot of deviation, it can't be straightened in an ER, but seeing us within a week is great because we can still take care of it. But like you said, once it hits 2 weeks, it's hard to push on it to line it back up. And, I'd say that's sort of if there's a finger with a lot of angulation, I like it when families go to an ER where they can get a little sedation or numb the finger up so they can try to line it up. So we can avoid a full surgery for a kid. That's my ideal situation. And then sometimes, I bet you probably do the same thing when kids see me in the office. If they're old enough and the finger's angled, I'll try, we'll numb the finger up, but it's a needle stick, kind of terrifying, especially my teenagers. But sometimes they'll do it, and then we can straighten it up there. But some of these injuries are not stable, even if you line them up without some other fixation to kind of hold it. And what do you tell kids about that, holding it in surgery?
Yeah, I like what you said about the office. So sometimes, excuse me, in our office, we can provide numbing medicine. I have no idea what the age is where kids will tolerate it. It really depends on the kid, and it depends
Totally
on the parent.
depends.
It depends on the parent,
Yeah.
how much the parent's going to be like, all right, just suck it up for 5, 6 seconds, and then we're
Yeah.
done. Um, so I like the idea of doing that when possible, and I like the idea of avoiding the operating room. But I think, as you said, if we do have a fracture, which is out of position, and we do have to go to the operating room, if we can do that at 7 to 10 days, then everybody wins, because we can
Yeah.
almost always push the finger back in place, occasionally adding a little metal pin or two to hold it in place for a few weeks while it heals. And that's a win. It's a win for everybody, because we don't want to do a bigger surgery. And thankfully, bigger surgeries are not, they're just not regularly needed.
Yeah. Yeah, I think for me, when I think about going to the operating room for finger injuries, it's mainly for alignment, or sometimes there's little tiny fractures kind of at the joint. And I think that's really important to make sure if the smooth surface of the end of the joint, like at the end of like if a chicken leg, that smooth surface where it bends, if that's not lined up, that's something we have to fix. And unfortunately, sometimes those we make little incisions for. But usually, pins, and I tell kids what I tell them it looks like paper clips, and a paper clip sticking out of the finger. So that way they're not terribly surprised when the dressing comes off afterwards. And we just wiggle those out in the office, and that's not terribly uncomfortable. It pinches for a second. And then we get things moving. I don't know, but I usually take pins out around 4 weeks in the office. I don't, your time frame is probably similar to that. And then what do you do after that?
Yeah, time frame depends a little bit on the fracture, and again, a little bit
Yeah,
on the kid, a little bit on what sports they're interested in. Because one thing I would say is, I don't let kids return to sports if they have pins in. And I
right.
think both
Yeah,
of us are pretty liberal. We'll get your kid back to sport as soon as possible, but we have to do it in a responsible, safe way. And so, if let's go back to your example. So let's say it's now 4 weeks out. We had to take a child to the operating room. We got the bones back in place. We put 2 pins in. At 4 weeks, I usually take the pins out. And then, depending again on different factors, I'll do one or two things. Either I'll send you to therapy, to a hand therapist. We have great hand therapy partners, and they can make a little brace that's form fit for you. And they can also instruct you on motion. And occasionally, they'll even see you back once a week or something like that. Or if it's already doing well and the x-rays look great, there's healing, and your child is already kind of demonstrating that he or she is going to move well, we'll do what's called buddy taping. And I love buddy taping. So if you think about the small finger, it's kind of sitting out here on its own, and it can kind of get hit or pulled. But if you tape it to the ring finger, then it's really protected. It can't really get jammed. It can't really get pulled apart. And so the buddy tape is really a great option. We don't want to overuse it, but it can be a great option. How do you think about therapy versus buddy taping?
yeah, no, I think you're right. It really depends on the kid. So when the pins come out and it's just kind of happens. Um, sometimes some kids are very hesitant. And so I think that therapy is a great tool to kind of encourage them to get moving. And then the parent is not the bad guy, right? So the parent is not the one forcing him to do it, but sometimes it's just a one-time visit to kind of encourage and let them get things moving. I do like buddy tape. I do that very frequently. And that's also what I use for sprains, like we were talking about early. Just doing little buddy taping helps to protect the sprained joints to get it moving. And I know a lot of coaches, athletic trainers out there do that a lot too. But I like buddy tape. I think it's great. And I tell, sometimes I go from a protective brace to buddy tape, and I'll tell them that, that ring finger or the adjacent finger becomes the new splint that can bend, but still provides a little protection. So
Yeah,
yeah,
perfect. We probably should, we have, I think, about 10 more minutes. We probably have a
yeah,
couple other specific injuries to talk about? I don't know what you think, talking about a skier thumb or a gamekeeper thumb. I don't know if
Oh
that's
yeah,
on your
absolutely.
list. Okay. What,
Yeah.
so let's say, you know, you have a 13-year-old child and she is playing tackle football with her brother and she jams her thumb. And usually that means the thumb gets pulled this way or can get pushed down, but jams the thumb and really, really hurts on the inside of the thumb and it's swollen. And they come to see you. What are your thoughts and what do you do?
Yeah. Well, first, the reason you call it skier's thumb, just so people know, it's like when the ski pole gets stuck and pulls your thumb sideways. That's why we reference it that way. But I think that, those kids for sure need an x-ray. Because most of the time, like we were saying before, that the bone's a little softer than the ligaments. But that is typically a ligament type injury where that ligament that provides stability to the thumb pulls off and takes bone with it. But it's a representative of the ligament not providing, coming off, and then the joint doesn't have stability. So I do like getting an x-ray, and typically there's a little piece of bone that's pulled off, and if you really cranked on the thumb, which I don't typically do, the thumb would be unstable and you'd pull it sideways. So I do think I'm an advocate for making sure that piece of bone is lined up so it heals to give the thumb stability in the future. There's a lot of ways to do it. I don't know what your method or your thoughts on that. And I think that's a surgery unless it isn't displaced at all. If it's sitting perfectly, I think a cast is reasonable. But
Yeah, you know, kids and adults are very different with this injury. It's the same injury, and as Dr. Wall said, it can be a ligament versus a bony fragment, and they're very
mhm,
different. So, you know, the most notable recent injuries, I think, in this pro sports world, Drew Brees had this injury. Other, you know, lots of people have had this injury. Locally, our catcher for the Cardinals, Molina, has had this injury. And those are pure ligament injuries. With kids, as Dr. Wall said, it can be fractures. And so we try to
yeah,
avoid surgery. And if we have to get the bone back in position, we'll do a little surgery and put usually a couple pins in and then cast. And then thankfully, people do great with this injury.
do really well. Yeah, yeah. Um, I feel like you had another specific injury you were thinking about.
I
I can't
did.
remember. Yeah.
So the classic, and again, I'm going to be a little ageist and a little sexist with this comment, but classically, the 15 to 17-year-old boy can have challenges with controlling their anger sometimes, or men,
I was going to
or
say it doesn't stop at 17.
yeah, and it can be women, but we're gonna,
Absolutely.
you know, but typically we see anger issues where something is punched,
Yep.
um, and usually, thankfully, it's not another person. It's often a wall or a tree or whatever, and we're happy that it's not another person. And the punch is done incorrectly, and kids get what's called a boxer's fracture. The irony, of course, being that boxers don't get this fracture, but it is a super common injury. Do you see a lot of these in your practice?
Oh, I see a ton of these. And I will say I do take it upon myself every once in a while to have that discussion with with the kid about they will never win. The tree always wins. And we still see them come back again and again with these. So but yeah, so what it actually is, it's the metacarpal bone. So we've discussed a lot about the finger, but so this is now at this level a little bit more in the hand. And so this bone here, and it's usually the small finger one, breaks right at this level, which we call the neck of the bone. And then the ball part that has the joint bends down. And so that bends down. Most of these, and I'm assuming you agree, most of these we can treat, with some immobilization, either a splint or a cast. There's some good studies to show that one is not better than the other. So for me, it depends a little bit more on the comfort, of the family and of the kid, of what they'd be most comfortable in. So
Yeah, a couple additional thoughts. I think that's perfectly said. Again, if
yeah.
you look at your hand and it does this bump, and so you lose your knuckle, like you don't
Hmm.
see it because it's bent down. And thankfully, it's really well tolerated. So even if it's angulated, it's most likely okay.
Yeah.
Occasionally, it gets so bent down that we have to do something, and that would be again a relatively small surgery, and often with pins. What's interesting to me is that as common as a boxer's fracture is, it does get overcalled sometimes. And so sometimes someone labels either a different injury a boxer's fracture, and we have to make sure that if it is a boxer's fracture, we're going to treat it like a boxer's fracture. But if it's not a boxer's fracture, we got to treat it correctly. So we like to see patients with this injury to make sure that the right diagnosis is made and to really give our assessment on whether or not surgery will make sense.
Yeah, absolutely. I think in the other ones are the ones where it starts to travel up the bone because sometimes those aren't tolerated and people can't extend their fingers or, they don't heal quite right. So,
Yeah.
and I think that those also people worry too, once again. So in the fingers, the growth plates are at the base of the bones. And then the other thing is this bone, actually, the growth plate is out here at the end. And so that's also very concerning for people. But the good thing is these actually can straighten out a little bit over time, depending on the age of a kid. I think it's one thing we haven't discussed is that growth plates can actually straighten bones if it's bent this way and you do a lot of motion this way. If the kids are young, they can straighten out a little bit, which is very optimistic. But one of the things you've always told me is the kids that don't tolerate this boxer's fracture well are those that where there's more prominence in the hands. So your baseball kids who have to hold a bat. So I think sport does play into some of my treatment for them. So that's something to consider.
I think that's exactly right. So we think about lacrosse players,
Mhm.
or what's interesting though for baseball specifically, it's your lower hand, it's your non-dominant hand, which really requires the tighter grip on the bat, and most people there punch with the other hand. So baseball can be an issue. Field hockey can be an issue. But you're right. Again, hopefully we avoid having to do something and just let this thing heal. So I think we're almost out of time. What are your take-home messages for all of our listeners? And we are so grateful that you've joined us.
Yeah, I guess my take home just sort of start at the very beginning. If there's bleeding and there's any sort of concern at the fingertips, I'm more of a ER fan. Get that evaluated there. I think as you start coming down the finger, if you can't straighten the finger, those probably need to be seen by someone like us, like a hand surgeon, to make sure it's being treated correctly. Sprains, give it a couple days if it's just kind of swollen. Continued concerns, X-rays are great to get to fully evaluate, and then specifically fingers that are going the wrong direction, they're going this way or going that way, they overlap when fingers get flexed. Those are injuries that we need to see within the first week to week and a half to make sure those are taken care of.
Yeah, I think
Eh,
that's,
what
oh,
would
go
you
ahead.
have?
I'm sorry.
No, 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 I said, yeah, your turn.
Um, I think like anything, familiarity breeds comfort, and comfort makes treatment better. And so I wouldn't say that we at Washington University Orthopedics are perfect. We're not, but we see a lot of these injuries and we are comfortable with them. And therefore, I think we can make you and your child comfortable with them. I think doctors who occasionally see this or really deal with other parts of the body, this is what Dr. Wall and I do. And we have a whole team. We have great nurse
Yeah,
practitioners. As I said, we have great therapists. We have a great team of specialists that deal with these injuries. And so we think we can provide outstanding care and get things to heal correctly and get your child back in the game as soon as possible. So I don't know. We enjoy these, and we'll get you through it.
yeah. Thank you all for joining.
Thanks, everybody. Have a great day.